Hi, hello, I'm Denise Juarez, and I'm from the career of psychopedagogy. And right now I'm going to explain to you one of the herbs of medical herbs, and I choose cannabis. First, why I choose cannabis? Cannabis, I think it's one of the most medical herbs that we use in the way that it can be different, like the religious, like a drug, like a medicine, and there are a lot of things that you can do with the cannabis. For example, you can eat it, you can put it in oil, you can use it like an fabric, so you can do a lot of things like clothes, like baskets, like a lot of things of objects that you can do with this kind of plant. You can use the roots, the seeds, the leaf, the flower. So that's why I choose cannabis. And now I'm going to explain to you the medical herbs of cannabis. First of all, the introduction. Cannabis is a genus flowering plant of the family of Cannabicae. There are 3 species that can recognize: the Cannabis indica, the Cannabis sativa, that it's the one that we're going to talk about all the time. It's this kind of cannabis is the one that we can use a lot of it, and it's the most famous for talking about the topic of the medical use and the hemps and all these kind of topics that we can use of cannabis, of the Cannabicae. So we are going to talk about a lot of Cannabis sativa and Cannabis rudelius. Cannabis is widely used as a therapeutic drug, especially by patients that are suffering from psychiatric and neurodegenerative disease. Cannabis is currently the most commonly used illicit drug in the world and one of the earliest plants cultivated by humans. Early evidence of cannabis use in medicine has been found in China and India for religious and medical use. The cannabis, it's not on the slides, but the cannabis, it has been found more than 1,000 years earlier, rather than the actual. And it's the one that they used more in the area of the religious or in the way of the soul or the spiritual way. So they use a lot of cannabis for traditionals from some areas that it has to be with the soul, with the culture, so they use it a lot. Medical herbs. These are plants that use as medicine. People use them to help prevent or cure an illness. They're used to relieve symptoms, increase energy, relax, or lose weight. Herbs are not regular and tested like drugs. This is very important because there are ways that it's not legal of using cannabis. So there's a lot of ways that it's not a good scene, cannabis, so it's not tested like drugs for seeing what is happening with this cannabis or what these plants do with the body or with this area of the corporal or medicine way, because it's not that legal. So that's why we don't have a lot of tests about it. This is due to the chemical substance called the active principle. They are considered substances that are exerted on living organisms. A pharmacological action, beneficial or harmful. The use of plants in traditional medicine dates back in prehistoric times. but currently, science has made this possible to identify, isolate, and produce hundreds of active ingredients from the preparation of drugs used in treatments of various diseases. However, this traditional use of medical plants still persists. And now we're going with the extract. What is cannabidiol? CBD. Cannabidiol is a popular natural remedy used by many common ailments, better known as CBD. It is one of the then 100 chemical compounds called cannabidiols that are found in the cannabis plants. This is from the cannabis sativa. CBD is the second most common active compound within the marijuana plants. It can be derived in a relatively large quantity from the hemp to the use of medical treatments. CBD has many potential applications for suffering chronic disease. CBD has rapidly become the popular area of medical study from several reasons. First, it does not produce a high in patients who use it. Second, it does not appear to cause any symptoms or of chemical dependency. A low potential for abuse or addictions make it highly promising. CBD oil is made by extracting the CBD from the cannabis plant and then dilute it with a carrier of oil like a coconut oil or hemp seed oil. CBD can be found in a variety of products online in stores, including dietary supplements, bath soaks, drinks, and food. This is the most common way to find CBD. Tetrahydrocannabinol, THC, is the main psychoactive of the cannabinoids found in the cannabis, which means it causes the sensation of getting high that's often associated with the cannabis. However, unlike the THC, CBD is not as psychoactive. This quality makes CBD an appealing option for those who are looking for the relief of pain and other symptoms without the main altering effects and cannabis or other side effects related to some pharmacological drugs. Medical cannabis. The use of cannabis as medicine has not been rigorously tested due to productions and government restrictions, resulting in limits clinical research to define the safety and efficacy of using the cannabis to treat disease. Medical cannabis can be administered through various methods, including capsules, lozenges, tinctures, dermal patches, oral, dermal sprays, cannabis edibles, and vaporized or smoking dried buds. The body produces endocannabinoids, which are neurotransmitters that binds to the cannabinoid receptors in your nervous system. These are some ways to do the medical CBD or the cannabis to help the body or to increase the health or the release of pain. One of those are cannabis may reduce nausea or vomiting during the chemotherapy, reduce chronic pain and muscle spasms, relief against the chronic pain in sleep disturbance, improve appetite in HIV or AIDS, improving tics in Tourette syndrome. When usual treatments are ineffective, cannabinoids have also been recommended in anorexia, arthritis, glaucoma, and migraine. Using non-inhaled cannabis to relieve the chronic pain. Using cannabis for the neuropathic pain spasms associated with the multiple sclerosis and pain from rheumatic disorders, but was not effective to treatment because of the chronic cancer pain. That cannabinoids are effective in treating depression or anxiety disorders, attention deficit hyperactive disorder, ADHD, Tourette syndrome, post-traumatic stress disorder, or psychosis. It also helps with the respiratory disease such as asthma or chronic obstructive pulmonary disease, COPD, patients with severe liver or renal disease, chronic hepatitis C, psychiatric disorder or family history of schizophrenia, have a mood or anxiety disorder, risk of factors of cardiovascular disease. And now we're going to see how it can take the medical cannabis. You can find them in pills, smoked, skin creams, baked goods, like we already said, in sprays, in dermatological ways, in smoked ways, in pills, in creams, in pack, and there are a lot of ways to increase the cannabis or the CBD. It is difficult to predict the pharmacological response to cannabis because the concentration of cannabinoids varies widely. As there are different ways of preparing the consumptions, it can be smoked, applied as oils, eaten, infused in foods or drink, or lack production control. Oral preparation are problematic due to uptake of cannabinoids into fatty tissues, from which they are released slowly and insignificant first pass liver metabolism, which breaks down the non-THC and contributed further to the variability of plasma concentration. Now we're going to talk about the metabolism way. This, for me, it's a little bit confused, but I think for the way that we're talking about of the plants and of the nutritional way and how it helps with the body, with the health and all this illness, I thought it was very important to put it on, but I didn't understand it very well. I'm going to be honest with you, so please be kind with me. The metabolism. Delta-9 THC is the primary molecule responsible for the effects of the cannabis. Delta-9 THC is metabolized in the liver and turns in 11-OH THC. 11-OH THC is one of the first metabolic products in the pathway. Both delta-9 THC and 11-OH THC are psychoactive. The metabolism of the THC into the 11-OH THC plays upon the highest psychoactive effects in the bowls of cannabis. Next, 11-OH THC is metabolized in the liver, 11-COOH THC, which is the second metabolic product of THC 11-COOH-THC is not psychoactive. Ingestion of edible cannabis products leads to a slower and onset of effect that are inhalation of it because the THC travels to the liver first through the blood before it travels to the rest of the body. Inhaled cannabis can result in THC going directly to the brain, where it then travels from the brain back to the liver, recirculate from the metabolism. Eventually, both routes are metabolic results in the metabolism or psychoactive THC to inactive 11-COOH-THC. Lendrance strains. Cannabis seeds may have been used for food, rituals, or religious practice in Asians in Europe and Asia. Lendrance strains of cannabis develop over the countries they are cultivated of plants that origin in one specific regions. Here we have the leaf of indica, sativa, and rudelaris. And here we have the images of how they grow. The sativa, that it's the most common one, that it's in the flower. Indica, that it's more in the leaf, the way that we use it. And the rudelaris, that this one it's not most is the most non-famous. Now, the traditional use. Cannabis has a long tradition of use in many cultures around the world. It was traditionally used for medical purpose, production of fibers, ropes, textiles, and paper. It served as valuable sources of food, and it was one of the important elements in the shamanic rituals. In conclusion, in this data set, the majority of reports were present by medical. It was the 75.41%, followed by psychoactive, 8.35%, and alimentary, 7.99% use. The most commonly used plant apart where the leaf was the 50.51%, seeds 15.38% in Florence, 11.35%. We found that in different cannabis plants, parts that are significantly associated with the different uses. The leaf was typically used for medical, seeds for alimentary, and in Florence for the psychoactive use. Regarding to the human medical use, most common were reports for treatments of the digestive system and nutritional disorders. There were 17.66%, nervous system and mental disorders, 16.24%, followed by the pain of inflammation, 12.21%. We found a significant relationship between the use of certain cannabis parts and treatments of aliments and body system category. Leaf was significantly associated with treatments of two categories. One, skin and subcutaneous tissues disorder and circulatory system and blood disorder. Seeds use one associated with muscular or skeletal system disorders and traumas, while in Florence use shows a essential support for treatment of nervous system and mental disorder. And that's it of my part. I hope you enjoyed it because I enjoyed it very much research about this topic because it's one of the things we talk the most, and it's most of the topics that in the political way we use it, or we always see in the news, in the TV, but we really don't know very well the things that we can use in cannabis. So that's why I choose this topic, and I hope you enjoyed it most as I enjoyed it. Thank you.